My name is Stanley Souls. I'm a family nurse practitioner student at Albany State University. I want to talk to you today about depression as part of mental health. Some of the facts of depression are the symptoms are persistent, sad, anxious, or empty mood, feelings of hopelessness, pessimism, feelings of guilt, worthlessness, helplessness, loss of interest or pleasure in hobbies and activities that were once enjoyed, including sex, decreased energy, fatigue, being slowed down, difficulty concentrating, remembering, or making decisions, insomnia, early morning awakening or oversleeping, appetite or weight loss or gain, overeating, thoughts of suicide or death, suicide attempts, restlessness, irritability, persistent physical symptoms that do not respond to treatment, such as headaches, digestive disorders, or chronic pain. Depression symptoms in children and teens are a lot the same, but they can be a little different. In younger children, symptoms of depression may include sadness, irritability, hopelessness, worry. Symptoms in adolescents or teens may include anxiety, anger, and avoidance of social interaction. Changes in thinking and sleep are common signs and symptoms of depression in adolescents and adults, but it's not as common in younger children. In children and teens, depression often occurs along with behavioral problems and other mental health conditions, such as anxiety or attention deficit or hyperactivity disorder, ADHD, and schoolwork may suffer. Depression symptoms in older adults. In older adults, depression may go undiagnosed because of these symptoms. For example, fatigue, loss of appetite, sleep symptoms, such as the loss of sleep or also the loss of interest in sex, and other things that may be caused by other illnesses. Older adults with depression may have less obvious symptoms also. They may feel dissatisfied with life in general, bored, helpless, or worthless. They may also want to stay home all the time rather than going out to socialize or doing new things. Suicidal thinking or feelings in older adults is also a sign of serious depression that should never be taken lightly, especially in men. Of all people with depression, older adult men are at the highest risk of suicide. Some more facts are the main types of antidepressant medications are the SSRIs, and some of those with the brand names are Celexa, Lexapro, Paxil, Prozac, Zoloft. Some of the side effects there, they can cause stomach upset, sexual problem, fatigue, dizziness, insomnia, weight change, or headaches. Another example are the serotonin and norepinephrine reuptake inhibitors, the SNRIs. That's a newer type of antidepressant. Some of these are Effexor, Pristiq, Cymbalta, and some of their side effects also include upset stomach, insomnia, sexual problems, anxiety, dizziness, and fatigue. Another type is the TCAs, the tricyclic antidepressants, and they were some of the first used to treat depression. They include Elavil, Pamelor, and also their side effects include same as other stomach upset, dizziness, dry mouth, changes in blood pressure, changes in blood sugar levels. The MAOIs are also some of the earliest treatments for depression. Some of the examples of that are Nardil and Parnate, Marplan, EMSAMs. They work well, but they're not prescribed very often because of the risk of dangerous reactions. They can cause interactions with other medications and certain foods. Food can negatively react with the MAOIs, and these foods are aged cheese, wines, chocolate, banana, and chicken liver. And some more medications are Wellbutrin, and it's different than other antidepressants, and only weakly affects the brain chemicals that other antidepressants influence. Side effects are usually mild, including upset stomach, headache, insomnia, anxiety. It may be less likely to cause sexual side effects. Another one is Remeron. It's usually taken at bedtime. Side effects are usually mild and include sleepiness, weight gain, elevated triglycerides, and dizziness. Another one, Desiril, is taken with food to reduce the chance for stomach upset. Other side effects may include drowsiness, dizziness, constipation, dry mouth, blurred vision. What is depression? Major depression is a mood state that goes well beyond temporary feeling sad or blue. It is a serious medical illness that affects one's thoughts, feelings, behavior, mood, and physical health. Depression is a lifelong condition which may alternate throughout the life and reoccur. Each year, depression affects 5 to 8% of adults in the United States. This means that about 25 million Americans will have an episode of major depression this year alone. Depression occurs 70% more frequently in women than in men for reasons that are not fully understood. Without treatment, the frequency and severity of these symptoms tend to increase over time. Major depression is also known as clinical depression, major depressive illness, affective disorder, and unipolar disorder. It involves some combination of the following symptoms: depressed mood, or sadness, poor concentration, insomnia, fatigue, appetite disturbances, excessive guilt, and thoughts of suicide. If left untreated, depression can lead to serious impairment in daily function and even suicide, which is the 10th leading cause of death in the U.S. Researchers believe that more than one-half of people who die by suicide are experiencing depression. Devastating as this disease may be, it is treatable in most people. The availability of effective treatment and a better understanding of the biological basis for depression may lessen the barriers that can prevent early detection, accurate diagnosis, and the decision to seek medical attention. Getting an accurate diagnosis is extremely important. First, rule out any other possible medical conditions that may mimic depression, such as hypothyroidism, complications from substance abuse or dependence, infections, diseases, anemia, and certain neurological disorders. Understanding the physiologic context, including the risk of psychiatric context, including the risk of bipolar disorder, and assessment of safety risk is also an essential aspect of an evaluation. And what to do if you have depression? Try to get help. And where you may get help for depression is at family doctors, mental health specialists such as psychiatrists, psychologists, social workers, or mental health counselors. You can get it at health maintenance organizations, community mental health centers, hospital psychiatry departments, and outpatient clinics at university or medical school affiliated programs, state hospital outpatient clinics, family service social agencies, private clinics and facilities, employee assistance programs, and at your local medical or psychiatric societies. And there's also ways you can help someone that has depression. They are: recognize the symptoms, convince the depressed person to get treatment, or in the case of a depressed child or adolescent, help the youngster get treatment. Tell the depressed person that he or she is loved, recommend help and resources, and if they're not functioning, accompany him or her to get help. If the depressed person is too young or ill to provide needed information, assist them to get therapy, to communicate to the therapist. And if the depressed person is suicidal or having hallucinations or delusions, arrange for hospitalization. If the depressed person is functional and refuses treatment, seek the assistance of others. And those are ways that you can help with depression. And the reason for this, we're hoping to make public awareness what they can do to help people and how to refer to other facilities or agencies and help them get through the process so they won't feel alone. That concludes the presentation.